New heart hubs are now open in Kitchener and Guelph as consumption and treatment services sites shut down. Public health officials are working with community partners to provide additional supports for those who are vulnerable in our communities. Let's discuss with Dr. Matthew Tenenbaum, the Associate Medical Officer of Health in Wellington, Dufferin, Guelph. Dr. Tenenbaum, great to see you as always. Thanks for your time.
Thank you very much for having me.
So in addition to those supervised consumption services, the Guelph CTS site also offered harm reduction supplies. In order to bridge that gap now, Public Health is working with community partners. Can you tell us more about the supports in place and the initiative that you're working on?
Sure. So harm reduction basically encompasses a number of different things that we can do as a community to help people who use substances, opioids and other substances, from experiencing harms that are avoidable. So things like providing unused needles or other supplies, things like supervised consumption, as you mentioned earlier. These are different things that we can do to help those who use to use more safely and therefore be at lower risk of things like injury or death. So as you mentioned, there is a transition in our community. The CTS, Consumption and Treatment Services site that was being hosted in downtown Guelph at the CHC is transitioning now into a heart hub model, which is a new model of care. But the CHC, ourselves, and other partners who were involved in our response to the opioid crisis are still mindful that we need to have certain harm reduction supports in place. So we are making sure that things like naloxone are easily available, things like unused sharps and supplies are available, and that we're continuing to do education with the community about how to use more safely and how to be alert to some of the risks involved.
So if successful with this partnership there at the library, where people will be able to access those naloxone kits, could we see this branch out to other locations in the downtown core as well, or are there other locations where those kits can be accessed right now?
Absolutely. So naloxone is a medication that we really do want to make widely available. It's a critical part of responding to an emergency if someone is experiencing an overdose or a drug poisoning. Essentially what it is, it's a spray that someone would receive in the nose if they're found, unconscious and you think they may be experiencing an overdose. And that medication administered through the nose can actually reverse that person's overdose. The idea is that if you're having an overdose, that can actually keep you from being able to breathe, and that's how people die from overdose. Whereas this medication helps to reverse the impact of the drug or the substance, allows that person to respond and to keep breathing, and therefore keeps them alive. So, over a number of years that we've been responding as a community to the presence of opioids, we have been expanding access to naloxone. There are a number of places in our community, including public health offices, where you can access naloxone kits, as well as access training and information about how to use it. We are always looking for new partnerships, including new places that make sense to stock naloxone, because people who might benefit from it might be, clients or people who are visiting. The library site in Guelph, the main site on Norfolk Street, is one new addition, and we're very pleased to work with them to enhance access to naloxone in our community.
Okay. Is there a way that community members can come together to help with those harm reduction supports that are in place in Wellington, Dufferin, Guelph? And if so, how can they help?
Absolutely. So I have to say, I've been working in the community for about 6 years now, and I've been really privileged that we as an organization have a number of great partners who have come together in the Wellington Guelph drug strategy. So across Ontario, different areas have their own drug strategies. For us at WDG Public Health, we have one drug strategy for Wellington and Guelph. We also have our role in the Dufferin-Caledon drug strategy, which is another part of our geography. But essentially, those drug strategies have, basically a way to convene to bring together different partners, including people who have lived and living experience with substances, to be able to think critically about what's happening in the community, what the data tells us, what kinds of trends are emerging that we ought to be worried about or responding to, as well as sharing ideas and innovations for how we can respond flexibly and creatively. As much as the opioid crisis is a provincial issue and a national issue and an international issue, we know that different communities have different sort of typical characteristics about them that affect how people experience that overdose crisis. And our job working with partners is to make sure that we are really understanding the local impact, as well as what we can do locally to change the trajectory of the crisis. So we do have a drug strategy that brings together many partners in our community that forms the nexus of how we respond together as a community.
Well, you mentioned how the opioid crisis is, of course, a provincial issue. How important do you think it is for people in our local communities to understand really the complexity of the crisis at this time?
I do think it is really important to appreciate the complexity, appreciate that, people who are addicted to substances that we know are highly addictive really face challenges, and that as much as we do want to make sure we're helping them in ways that make sense to us, we're also trying to understand the experience that people are going through to make sure that the ways we are trying to help are going to resonate, are going to be effective and successful. And there are a number of different, modalities, different ways we can try and tackle this challenge. And we're trying to make sure we root our approach in data and make sure that we are really considering the needs of the community as we respond. There isn't a playbook for this that you can just apply without thought. You really have to be critical, evaluate what's happening, try things, experiment, see how it goes, change your approach. And our approach to responding to this crisis has really evolved and changed over the number of years we've been dealing with it. Unfortunately, it is still a challenge in our community, and that speaks to the fact that we need to continue to try new things, be willing to make changes in our approach, and always center the experience of people who use substances, as well as the experience of people in our community, to make sure we're doing the right things and getting the balance right.
Yeah, it's such a good point. There really is no one size fits all here. It's such an important conversation to have, Dr. Tenenbaum. Thanks for having it with us. Dr. Matthew Tenenbaum is the Associate Medical Officer of Health in Wellington, Dufferin, Guelph. Thanks again.
Thank you very much.